You're listening to the Fertility Docs Uncensored podcast, featuring insight on all things fertility from some of the top-rated doctors around America. Whether you're struggling to conceive or just planning for your future family, we're here to guide you every step of the way.
Hello, everyone. This is Dr. Susan Hudson from Texas Fertility Center with another episode of Fertility Docs Uncensored. I am here with my amazing, audacious co-host, Dr. Abby Eblen from Nashville Fertility Center.
Hey, everybody.
And Dr. Carrie Bedient from the Fertility Center of Las Vegas.
Hey, guys. How's it going? Going good.
Doing good. And we are so excited. We have Dr. Nicole Marchetto from Shady Grove Fertility in the Pennsylvania region joining us today. How are you doing, Nicole?
Hi, everyone. Thank you so much for having me on. I'm really excited. I love your show.
Oh, thank you.
Thanks. We're excited to have you. We added a time zone in here.
Yeah, that's true. We did.
Messing things up.
Absolutely. Absolutely. So I understand you recently had a peach picking expedition.
Yeah.
Tell us, what did you do?
So there is a farm not very far from my house, and they do pick your own all throughout the year. So we've been trying to go every season to try to hit whatever is in season.
Wow.
So we did strawberries back in May, because that's on the East Coast. That's when they start. And then recently we went peach picking, and there were at least a couple of acres probably filled with peach trees, and we picked them right from the trees. We were able to eat them directly from the tree, which was pretty awesome. They were already ripe. And then I have
wiped the bugs off and kind of took a bite of them.
Yeah. And we have a whole box that we've been working our way through with different recipes. We did do peach ice cream, which was fabulous.
Yeah.
My next recipe that I'd like to make is either peach cobbler or peach scones. So that's what we're looking forward to this week.
I think you can char grill like peaches on the grill too. I've heard that. I haven't done that, but it looks really good.
Yeah, we haven't done that yet, but I have a recipe for that too. So we might have to go pick more because we are really actually going through them pretty quickly.
So in our area of Texas, in probably about early July is when peaches are ripe, and there's a town called Fredericksburg, and they're known for their peaches. Our peaches tend to be smaller that are from this area, but they tend to be very sweet. Are y'all's the big ones?
Yeah, they're big. The farm that we went to had yellow peaches, nectarines, and white peaches. I prefer the yellow peaches, but they are the big ones. And they had donut peaches too, which are
oh, that sounds really good.
Yeah.
What are donut peaches? I don't know that.
They look like donuts, like little tiny.
Oh, I've seen those before. Yeah.
If you're a nerd, they look like red blood cells with
Yes, that's right, with the divot. Yeah.
They don't have
We're all nerds here.
Yeah. They don't have the full hole right in the middle. It's just that kind of dimple. And so
there you go. So did they get a bigger yield this year? Because I know at least in Tennessee, we got tons of rain, and I have a fig bush, and I've never in all the time I've had it for 10 or 15 years had this many. Every day I'm taking 5 or 6 figs off of it. And we even made fig jam. So that might be another thing you do with peaches.
Yes. Yeah. I thought about peach and jalapeno jam. That was something that
that'd be really good.
Yeah, we do. I think that they had a very good year. So I'm looking forward to the apple season too, because I think it was a good year for everything.
Yeah.
That is fun. Very yummy. I wish I lived in a place that you could go and pick fruit that easily.
mm-hmm. we went to Oregon this summer and picked blackberries on the side of the road.
Oh, that'd be fun.
Everyone in my family made fun of me because I asked a local guy who was probably, I don't know, he was like 20 years old that we just happened to run across, like, oh, hey, where do you find blackberries around here? Can you like pick them off the side of the road? Because the bushes are everywhere. And he's like, yeah, sometimes I see old people out there picking them. And he said it with a completely straight face. Had absolutely no idea what he said. And my husband and my mother are sitting.
He didn't think you were old, though, Carrie. Yeah. He didn't think you were old, or he wouldn't have said it.
Right.
No, he 100% was implying whether he meant it or not, which I don't think he did because he was a very sweet young man. But I have not heard the end of it, and it's been well over a month.
You're generationally a part of the blackberry pickers.
Clearly. But I made a really good cobbler, so I'll take it.
There you go.
Awesome. Good stuff. Well, exciting news from Fertility Docs Uncensored. Our long-awaited book, The IVF Blueprint, is now available on Amazon. Go now to pre-order your copy to learn everything you need to know about IVF, egg freezing, and embryo transfer. Did you know that you can cram decades of experience, science, and heartfelt advice into a book, and then the whole thing hinges on what happens in week 1? Yep, week 1 is basically the prom queen election of publishing. So if you've ever thought, I should check out the IVF Blueprint by the Fertility Docs Uncensored crew, now is your moment to shine. Buying it early tells bookstores, hey, stock this. It tells publishers, people care about this. And most importantly, it helps get real information into the hands of people staring down fertility treatments with more questions than answers. The book's called The IVF Blueprint. It's for folks considering IVF, already in the thick of it, or just trying to figure out what the heck their doctor is talking about. Help us help more people, and maybe confuse a few algorithms while you're at it. Let's go to a question. Our question for today is, hi docs, love your podcast. We're preparing for our second embryo transfer after a successful one in 2022. They have 6 untested embryos, a day 5 4BB and a 3BB, and 4 day 6 for BBs. I'm anxious about failure. Would you recommend PGT testing now, or is the thaw refreeze risk too high? Also, a 12 millimeter polyp was found on saline ultrasound. I'm awaiting hysteroscopic removal and wonder if transferring the following cycle is okay. I had a C-section and my REI noted significant scar tissue. Thanks for your help.
All right, Nicole, what do you think?
I would say some of the answers depend on how old the patient was when they underwent the first cycle. She had success with the first transfer, which is great news. And if it were my patient, I would say we should go ahead and potentially try doing another transfer because there's no reason at this point to necessarily biopsy and test with risking the damage to the embryo with the thaw, biopsy, refreeze, rethaw. What do you guys think about that?
I think they're younger. I think that's really good advice. Sometimes in our state, we see people that are really uncomfortable having 6 frozen embryos. And also it's depending on if they've had a baby or 2. If they've had a couple of babies, just had a couple like this that thawed, tested, and refroze. And ironically, all the ones that we tested, 5, were all genetically normal after they did all that. So I think most of the time, for a young patient, it's reasonable not to thaw and refreeze.
Yeah, the times that I would think about having a patient thaw and test if it was untested to begin with is if they're failing multiple transfers. So if I'm worried that maybe there's something else going on, maybe they have a higher rate of abnormal eggs, abnormal embryos, then at that point I would recommend taking the risk. Depending on the lab, each lab and each practice will have different rates of what the impact of a biopsy and then refreeze, rethaw, that kind of thing. Ours is not a significant reduction, even with the double biopsy. So if somebody comes back with PGT, a no result or a no call, and they get rebiopsied, we say it's maybe a 5 to 10% decrease in success rate. But yeah, you're going to have to weigh the risks and the benefits and make sure that the patient understands what the outcome options are.
I would completely agree with that. I would probably transfer 1 or 2 of these other embryos. And if we weren't successful, then talk about, we've got 6 embryos there. That's a good number of embryos. And sometimes people want that information for trying to plan how many children are we going to have, kind of mentally preparing, wow, I didn't expect to have this many embryos frozen. I really need to know the number of chromosomally normal embryos. But I would, as much as I love PGT testing, at this point, because you didn't opt for it at the beginning and you had a successful transfer, that's very reassuring.
I have a question for all of you. So if, say, the patient, which would be really unusual if she had 6 untested embryos, but say she was 38 or 39 and had 6 untested, what would you say then?
Because she was successful with her first transfer, I would probably transfer 1 or 2 more embryos to see if we can get another pregnancy before incurring not only the risk to the embryos, but that's going to be a significant financial cost. It is more expensive to test embryos that have already been cryopreserved because you're adding lab expense.
Yeah.
And so if we can ride the wave of success, then that's great. But I wouldn't transfer all of those embryos without at least having a conversation. Some people may choose never to test them, but then I might, if she was 38 and we had a couple of unsuccessful transfers, then maybe going to a 2-embryo transfer, though I don't do very many of those nowadays.
So I have a question for you. The first one in line is for sure going to be that day 5 4BB because it's the best quality embryo on day 5. Let's say that she transfers that one and for whatever reason needs to transfer another one, either because that first one doesn't work or because she is now looking for a third child. And she has the option between a day 5, but a 3BB versus 6 or one of the 4BBs. So which would you choose and why?
Discuss with my embryologist because they're going to have a very strong opinion on that and probably a stronger than opinion than I'm going to have.
Same. I would argue that it probably doesn't really matter either way.
The one thing that I would think about, especially if it's a 3BB, I would say if it's a 4, 5, 6BB, then whatever, nobody cares. People are going to transfer the day 5. With a 3BB, because it's an earlier stage, that may be the thing where somebody pushes it, where an embryologist is going to have a different view of that. But a lot of that really is going to depend on the individual lab. So like for our lab, for me, the big cutoff is, did it get frozen or not? Because if it got frozen, I don't really care about the grading because that tells me everything I need to know is that they thought it was enough to freeze. There are other labs where they will freeze everything and those grades make a much bigger difference. And neither is right or wrong. It's just what your lab happens to be. And so I'm always curious how people approach those types of questions.
What about the part of the question regarding hysteroscopy? How long would you wait?
So I would tell her that she could, if everything came back normal or if there was like a singular polyp and the pathology was back and the cavity looked otherwise good, I would say that we could roll right into a transfer cycle in that following menstrual cycle. So let her get a period and then, potentially start the medication if it's a program cycle, or if she cycles regularly and is doing a natural cycle, we could do that next cycle.
Agreed.
Yeah, would agree with that.
And if somebody saw something else like adhesions or a septum or a little fibroid, maybe letting it heal for a month or 2 more, just depending on size and circumstances.
Mm-hmm.
Yeah, exactly. Yeah, they had mentioned maybe some scar tissue from a C-section. And so depending on what that looks like on the saline sonogram and whether or not she's able to make a nice lining, there was concern for Asherman's. I would probably take her back for a lysis of adhesions, potentially use a balloon, allow things to heal before moving forward and making sure, even doing a second look saline sonogram.
Yeah. But usually with just a plain old polyp, without the concern of adhesions that you mentioned, usually for that, we'll just take it out and immediately cycle, be able to go forward. It's the adhesions here that bring up the what if and choose your own adventure of balloon or hormones. Yeah.
To comment also for our listeners, if you've had a C-section, relatively speaking, most people don't have a lot of adhesions in the uterus, inside the endometrium from a C-section. And what most commonly happens is that they may have other adhesions in their abdomen. And so even when I was reading this question, I was like, did the REI comment on the OB-GYN's operative report from the C-section that she had lots of pelvic adhesions? Or were there adhesions that were noted in the saline ultrasound? Because realistically, if you have adhesions outside of your pelvis and you don't have any hydrosalpinx or swollen fallopian tubes, we really don't have a big feeling about that being really concerning for success rates. And it's really the adhesions within the lining of the uterus that make us more concerned.
It really surprises me how rarely we do see adhesions. I've seen adhesions sometimes when people have had IUDs put in, like maybe right after they had a baby, shortly thereafter. I just saw a patient in the office last week, though, who had a manual extraction even after C-section. And she had the little calcified chunk inside the cavity of what looked like just a small piece of placenta, but it was really obviously there.
Yeah, I think anytime that you have instrumentation, whether it's manual extraction of your placenta or having to have some sort of DNC, those are the times I think all of us get the little palpitations of, oh no, hopefully we don't have something in the uterus that's adhesion-wise going on. All right. Well, let's move on into our topic for today. Starting a family is one of life's greatest adventures, but sometimes the path to parenthood isn't as straightforward as expected. Shady Grove Fertility is there to guide hopeful parents every step of the way, offering compassionate care and advanced fertility treatments to help make parenthood possible. With their exclusive 100% refund program for IVF and flexible monthly payment options, Shady Grove Fertility makes treatment more accessible. Visit shadygrovefertility.com to schedule a consultation and take the first step, because the adventure of a lifetime starts with Shady Grove Fertility. Today, we're going to talk about something I think we have probably only once talked about on our podcast, and it's been a long time. We're going to talk about when should you go get a second opinion. Now, a lot of people are never going to need a second opinion, but it is kind of a sticky subject. It means you're wanting somebody else's opinion, and that's okay. But we're going to talk about what exactly is a second opinion, how can you get a second opinion, and when should you be weighing that as an option? All right. So, Nicole, let's start off with the basics. What exactly is a second opinion? What does that mean?
Sure. So a second opinion is when somebody is interested in input from a third party, like maybe another practice or another physician, where the patient is curious about alternatives and treatment approaches, or their opinion about what has been done and what could be done in the future. So it usually involves seeking out another practice or another physician and bringing along your records, and that second provider will take a look at what's been done and give their input about what could be going on diagnostic wise or treatment wise, what your options may be, and they could weigh in on what might be a different route for you.
When you're looking for a second opinion, do you actually have to leave the practice that you're at?
No. So great question. So I actually love second opinions. Sometimes I do recommend that my patients go look for a second opinion. If I'm stumped and I feel like we really have exhausted everything, I'll talk to them about it. And actually at Shady Grove in my region, we offer free second opinions too for patients if they're looking for just advice or somebody else to talk to. But I think that it's a good idea for somebody that is really wanting to learn more about what's going on and about the approach of what has already been worked up and done. There are a lot of different benefits to seeking a second opinion, risks as well, which I'm sure we'll kind of get more into. One piece of information I usually give my patients about when to look for a second opinion is thinking about where you're going for care and what are the strengths and weaknesses of that center. So is it a really small center where you got along really well with the provider, but maybe their lab is really small and not very high volume and it's limited what they can do? Do they do their egg retrievals at an outpatient surgery center? And is there anesthesia? Are there certain requirements for that outpatient center that are limiting to you? And are you thinking about maybe seeking a center that has maybe like a hospital setting for a retrieval? Is cost an issue? Is there a special program within a different practice that may be more financially reasonable for you? So these are all different things logistically that might be a reason to go seek a second opinion.
How often do you guys have, so there's the cases where we can say, I'm at the end of new things that I can think of to do here. And sometimes that's okay. Like sometimes really the next best thing is just to keep doing what you have been doing and wait for it to work. And while the definition of insanity is doing the same thing over and over again, expecting different results, IVF, that is not necessarily a true statement. So if you've got someone where you're telling them, go get a second opinion, that's easy, right? Because you're telling them they don't have to feel awkward about it all. What about patients who bring it up to you as an option, or patients who don't feel comfortable because they feel like, oh my gosh, she's going to hate me if I talk about going on a date with somebody else? How do you guys see that, and how do you feel about someone who says, hey, I'm thinking about going somewhere else to get a second opinion, or I did go somewhere else, versus someone who just ghosts you?
I'll take that one. I had a recent experience with a patient who really, really wanted to read and do as much research as she could about what she was going through. And I was really happy that she was doing this. She felt very empowered to look all of these different things up. We met frequently throughout her cycle to go through all of these different things that she was asking about, different treatment protocols, different things in terms of ICSI, not ICSI, testing, not testing, sperm factor, why potentially egg quality may have been an issue. And she did mention that she was interested in a second opinion, and I encouraged her because I wanted to allow her to explore what other practices may do. One thing she was really set on was potentially doing a day 3 transfer, which we don't do at our
Yeah.
center. And so I said, please go. These are some other centers that may do that. This is something that if you really want to explore, this is why we don't do it at my center. But we had a very open conversation. She told me when her appointments were. She wanted to be sure that she got information from these other centers before we ended up finishing her cycle. So I think it's the relationship between the physician and the patient is really important, and trusting your physician to be able to ask whether or not the third party, what their answer was for something. It was an opportunity to go through and share why we do things differently. And I think she appreciated that.
I think the challenge for patients is there's really no one source you can go to and go, okay, is my doctor doing things that are middle of the road? Is she way over to the right or is she way over to the left? And so there's really no way for patients to really know. They may trust you, but they're like, okay, well, my friend did this, this, and this. Why is my doctor not doing that? Is she not reading the literature like this other doctor is? That's why I really like patients to have a second opinion, because I think then they're able to put things in perspective and realize that, yeah, maybe 2 of their transfers didn't work, but it wasn't for lack of something on our end that we should have done and didn't do.
A lot of it has to do with how much, I mean, without a better term, on the edge you want to go. I had someone recently who there is a certain network of IVF centers that does theoretically almost everything you could possibly think of a la carte. And they'll let you do it just per request, whether it's medically wise or recommended and has data behind it, or it's the newest that's out there. And this patient, realistically, she goes, I started off there because I wanted to dictate what I wanted when I wanted. And unfortunately, at that situation, she didn't get pregnant. Then she came to us as a second opinion. I explained the things that I thought had been done well, the things that I thought might need to be done differently, and the reasons behind that. And everybody's going to have their perspectives. And that's one reason we love doing this podcast, is that we're in different parts of the country. All 4 of us trained at different places. We've all had different clinical experiences. But the thing is in infertility medicine, I would say 90% of what should be done, we're all doing. It's that 10% that you have to fit into. Is the right science? Is this the right personality? Is it the right feel? If there's something happening that you don't trust the process, that's a real important time to get a second opinion, to be like, oh yes, what they're doing does make sense from another person's viewpoint, because all these people we all have lots of years of getting all this knowledge in our brain to put it together for your specific clinical scenario, but it may not be blatantly obvious at the offset.
Exactly. So, what do you do when somebody comes back from their second opinion and they've had a good conversation, whether this is a second opinion that you knew about ahead of time, whatever? What do you do when they come back and the stuff that they're coming back with is something that you
don't
think
agree with?
Way out there.
is out there? It's scientifically or logistically just a little off. How do you approach those patients? How do you tell them what you think about that? Because you don't want to come across I'm thinking of a highly technical and professional term. You don't want to look like your butt hurt, but you also want to make sure that they have the information of your expertise, which is why they're coming to you as well. And presumably, if they've come back to you, they want your opinion as opposed to just going off and going with the second clinic. So how do you approach that when it's squirrely opinion, but we also don't want to come across like it's a hurt ego on our part that is contributing to what we're saying?
Yeah, I would say that it's really important to explain why you've chosen not to do something and why it exists out there. If it's something that may work, something that May be very expensive, but you can explain that the data are not strong enough to really support doing it in your case because, the outcomes may not be drastically different and it might be an added expense. You can also say this is why we don't do it here, but if this is something you're really interested in pursuing, it sounds like that practice does do it. I wouldn't recommend it for your case at this point, and that's why, we won't do it here, but you're welcome to pursue that if you feel like it's really important. But, as long as I feel like I've given them the information necessary to make the decision that's right for them, because sometimes the data may not be that important to them in terms of whether or not they feel like they've tried everything under the sun. But it's important that you explain how the data work and why the test or the treatment plan was ever made in that case. So I think having that open conversation and saying, everybody practices a little bit differently and some things are a little bit more fringe than others. And in some cases, I don't think certain things are safe. And so I don't want to put your health at risk or put the pregnancy at risk. But really, at the end of the day, they can make their own decisions about where to go and what to do.
Do you guys look at patients any differently when they come, when they go get a second opinion? And oftentimes there's a lot of hurt feelings on their part because they're in pain from everything they are going through. And we feel that as well because we're very invested in our patients. But of course, it's never going to be the same because this is their family, their child that you're talking about. So do you ever see a difference in how things work when patients are very open about their communication versus when they leave, they disappear, they're gone for months to years, and then they come back and say, okay, what's our next step? What are we doing next?
I think it's one of those situations where it really has to do with why did you decide to go get a second opinion? And getting a second opinion in itself is fine. I worry about patients who doctor hop for second opinions. So if you come to me and I'm the fifth doctor you've seen, like I said, most of us are doing similar things. Not everything's going to be the same. And if I'm really the fifth person you've seen, I doubt that all four people before me told you something wrong. Whereas being frustrated, being sad, grieving, really just needing to know, is this the right thing? Should I be doing something else? Or I'm coming to you because I know we can do this at your clinic versus I can't do it at my own clinic. I think those are very different situations. The pure second opinion versus the doctor hopping are different mindsets.
And to that end, Susan, I would say, and I'm sure you would agree too, that somebody that's seen 5 different doctors, there's something more there than just seeking information. I mean, I think you hit the nail on the head when you said they're sad, they're depressed, they're frustrated. And honestly, I think seeking counseling, if they haven't sought it at that point, is really the best route to go. I think they're using intellectualization to try and look at everything on the internet and make sure that they're doing everything. And I think in the long run, they're just really sad and really frustrated. And I think it would be really helpful for them to see someone to help them with those emotions, to help them process those.
I think there's a very different relationship that happens where someone just says, hey, we just want to talk to someone else and get that feel, whether they tell us that or not, versus if they leave in a huff and they're like, we don't trust you anymore. That is very, very different. And of course, it's always fine to go get the second opinion. But when you no longer trust a doctor, no matter who they are, you should not be back in that practice. And that feeling goes both ways because if you have felt to the extent where you have pretty much declared either through your words or your actions, I don't trust you anymore, then you shouldn't go back to them because they're going to have to give you bad news at some point. There's a decent chance of that. And when they give you bad news, you need to know that they did absolutely everything that they could to avoid that. And there's a level of trust in that. And so if you don't have that trust, you shouldn't be with them. Also, from the physician side, when someone says, I don't trust you anymore, we know full well that's not a good working relationship because of everything that we have to do. And because now we're starting to worry about everything that we say and we do. And that's not a good setup for excellent care. You want to know that your doctor is just automatically doing their best by you. And if you're constantly second guessing that, and if they're constantly second guessing, like, well, if I do this, are they going to think it's okay? Are they going to think I'm doing whatever reason?
And we do that as physicians, right? We do that as physicians.
100%. The decisions we make are very much based on the people we are treating, because you can have 3 couples with the exact same story who need very different care because of who they are as people, what their personal beliefs are, what they have previously been through, what their economic situation is. Like, we are thinking about the big picture here and try and be very communicative about that. But if that trust is gone, then you shouldn't be at that clinic for both your sake and your doctor's sake, because that's not a good setup for getting where you need to be.
I think the big thing that we've been talking about is trust. If you trust that your doctor is doing everything they can and you want to just make sure that there's nothing else that could go on that could add to your care, that is what I think is the fullness of a true second opinion versus transferring your care to another physician because you've lost that trust. I can tell you that we feel it. We know when you've lost that trust, and we're
Mhm.
doing everything we can do to regain it. But it is so much harder to get someone pregnant who doesn't have that faith that it's going to happen. I mean, we've all gone into that embryo transfer with that negative Nelly who's like, this isn't going to happen no matter what you do, blah, blah, blah. And you're just like, you just feel defeated before you walk in versus we're all working together as a team, patient, physician, nursing staff, administrative staff, everybody's in there for that common goal. It just makes a huge difference.
Anything else that you guys think about second opinions? Sometimes patients think, "Oh, well, they're never going to know that I've got a second opinion." And that's sort of true, but it's also sort of not true. How do you guys know that someone's gotten a second opinion without them ever telling you? Like saying, "Oh, hey, I went to go see Dr. X."
You get those records release forms.
Yeah, I would say that sometimes they probably do go for a second opinion, you never find out. And it may be that, they got a copy of their own records, or they, just said everything that was done. And sometimes I had a patient that went and did a whole cycle after we did a cycle for financial reasons, and then came back when her insurance changed. And I was curious about what they did and if they did anything different. And so I think, just for the listeners out there, any patients, if you feel like you do have a relationship where you can disclose that, it is interesting information for the physician, because it's nice to see how other people practice and learn from what they did, and maybe the person had more success at their clinic. I do feel like there is a big difference in labs in terms of different practices, and so sometimes it may just be a matter of take your eggs and sperm and see what happens in somebody else's lab, because maybe it's as whatever limitations there are with where they're going for care now. But yeah, when I find out, I try to encourage them to let me know what the other person thought, so I can either be open to it, for other patients, or learn what the practice differences are, at different centers.
One thing that we do at our practice is sometimes when somebody is getting that second opinion, they'll let us know, hey, I'm getting a second opinion because of blank. I'm having records transferred because of blank. And that helps us grow as a practice. And if it's because somebody else takes a different insurance policy than us, then I'm like, okay, there's not much I personally can do about that other than us trying to get better contracts and different things like that. But if there's been an interaction that I'm getting the second opinion because of something else, that can be helpful to us, because although you may not want to continue with us or whatever that may be, we want to continually improve our practices, our teams,
Mhm.
and creating a inclusive and inviting environment for everyone. And so that really gives us good information for building the experience in the future for others.
And when you come back from a second opinion and you say, I got a second opinion, and you leave it very generic, and then you come up with all these different ideas, or say they recommended X, Y, and Z, a lot of times we'll ask you, who did you go see? And it's very hard to separate this from personal egos. But part of the reason we're asking about that is because, while yes, 90% of REs are going to be doing the best that they can by you, there is a subsegment of our field which we don't agree with. And, we may have personal knowledge of them that we will never tell to you, because I don't think any of us are ever going to slam another doctor. Because that doesn't help anybody. That doesn't build trust anywhere. Like, that's not useful. But we will take it into account of, well, of course they said that because of XY thing that we know in the background that we are not going to share because it's not professional and it's not the right thing to do, but it will impact how we look at that decision and how we kind of phrase it and mirror it back to you and saying, okay, well, these are the pros, these are the cons, this is why I do that, this is why I don't do that, and this is why I may or may not think it's a reasonable idea for you to try at this stage.
That's a great summary.
That is a great summary. I also think it's important to also recognize that they may have some fatigue in going to one or two other opinions because they're going to get a lot of information and they're not
Yeah.
necessarily going to feel comfortable
Mhm.
parsing it out and knowing at that point, well, who do I trust and who do I go to? And at the end of the day, we are for the most part, the practices are all trying to help you get pregnant. And so sometimes it can be really difficult to think, well, is there one right decision? And the answer is most of the time there's probably not one right way of doing it. And so that's where the conversations become helpful. And the other factor that I think is important to make sure people realize is that if you are going for a second opinion, it may delay treatment, whether it is that you have to establish yourself with that practice or if they need to get other records or have other prerequisite requirements, or perhaps they have a wait list for their IVF stim cycle. And looking at the big picture and seeing where they are in treatment, it's important to also sympathize a little bit with those complications that come with the second opinion.
Well, very good, very good. Well, we have covered a very complicated but important subject of second opinions, and I'd like to thank Dr. Nicole Marchetto, who again is at Shady Grove Fertility. She is mainly in the Lancaster and Chesterbrook offices in Pennsylvania. But thank you so much for joining us today.
Thank you very much for having me. It was a pleasure, and I just loved talking with you guys about what we do on a daily basis.
Thank you.
Absolutely. Anytime, anytime. And to our audience, thank you so much for listening, and subscribe to Apple Podcasts to have next Tuesday's episode pop up automatically for you. Also, be sure to subscribe to YouTube. That really helps us spread reliable information and help as many people as possible.
Visit us on fertilitydocsuncensored.com to submit specific questions and sign up for our email list. Keep an eye out for our book that's being released September 20th, IVF Blueprint. Check us out on Instagram and now on TikTok.
And as always, this podcast is intended for entertainment and is not a substitute for medical advice from your own physician. Subscribe, sign up for emails, and we will talk to you soon. Bye.
Bye.
Bye.